Started. Hello, 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 hello to everyone. Please join in. Chalo, please join in. I hope you had the food. So I hope really you all ate something. What you ate? What have you eaten? Tell me. Chalo. Sleep also. Wow. Chole bhature, kheer, poha, Maggie. Wow. Movie. Very fast. Air and water. Wow. Wow. Dalia, coffee, noodles, Kit Kat. I ate idli. Idli with chutney. I avoid oily foods in the daytime. It makes sleep. Dal fry, jeera, wawa, yum, snack, apple, tea, very good. Pizza, upma, nothing. Don't worry. Those who are nothing, they can eat later. Don't worry at all. चलो चटनी नारी दिया obviously. Shawarma, great people. Air and water. Tiffin नहीं आया कोई नहीं. You eat when the tiffin comes. Okay, चलो. So let's start. Okay. Now we'll start. See, I've covered everything in proper details as you can see. Okay, whether it's respiration, it is neuro, cardio, ECG, acid base. I'm not skipping anything. Clear, and the notes are comparable to any other app. Even if I open the app and I'll show you their notes, you'll find कि our notes are having everything and they are very concise also, that we can easily go through them and revise. Okay, so that is what. Okay, chicken mandi, very good. खाना बन रहा है, very good. Okay, don't worry, I'll give you lunch break soon. Okay, maybe 2:40, 45. Just wait for 1.5 hours, then we will take the lunch. Okay, today target is to finish endocrine and I'm sure you will all cooperate to finish, because we'll need whole day tomorrow to finish the nephro and the GIT, liver, etc., because that is our hard work. So tomorrow we might start the class early also, 9:30. Okay, so tomorrow we'll start the class early, maybe 9:30 a.m. till 8:30. So 11 hour or 8 p.m. depends when will the syllabus be over. So that's the case. Okay, I eat everything. I eat to survive. So that is the case. Okay. So hematology, I'll give a brief outlook. Okay, Christina, just like I gave in TB. Clear. So I'll give a basic outlook about the hematology. Okay, how to differentiate. Okay, I eat everything. Don't worry. Okay, I eat everything. I eat to survive. Okay, I can eat anything. That means they can eat even. I'll not say name things, because survival is the main thing. If you are alive, you can do anything. If you are dead, there is nothing left to do. Okay, चलो करा देंगे भाई, टेंशन ना लो. देखो हर चीज, अब मुझे अब ये बोलो सर लेप्रोसी पढ़ाओगे क्या, सर विल यू टीच लेप्रोसी, तो मैं बोलूंगा भाई लेप्रोसी इज कवर्ड इन डर्मा, हाउ कैन आई कवर, सो आई विल से नो, आई कैन नॉट कवर. फिर कोई बोले कि सर विल यू डू एपिग्लोटाइटिस, सर Will you teach this tracheo, this LTB, that is laryngotracheobronchitis? So there is so much in medicine. Okay, medicine, you've seen Harrison. So there will be ENT parts also, patho also, micro also. So that it will become very vast. Okay, and will not be able to cover almost, anything. Okay, so that's what I'm telling you. Okay, we are not trying to get 100 MCQs, 100% MCQs. No one can solve. Okay, even app will fail. Okay, so that is the case. Okay, so my request is I will cover whatever is possible in the given time. Rest, you people are having access to the lectures. You can watch them, you can study them. It will be more than sufficient. Okay. Because I try to cover patho as much as possible, but I cannot cover whole pathology. It's so vast. It's so vast. Okay. Chalo. Let's start. Now we discuss the endocrinology. Endocrinology, and we'll start with diabetes. What is diabetes? What is diabetes? Anyone? What is diabetes? What is diabetes? Tell me. Anyone? What is diabetes? Right? What is diabetes? Okay, that's a misconception. Diabetes is not increase. Diabetes means increase urination. So it is a Greek word which means like a fountain. Okay, so there is increase volume, and increase frequency. So that is called as diabetes. So misconception, diabetes is not sugar. Diabetes is increase urination. Increase urination. Okay. Now there are two types of diabetes. Two types. Diabetes mellitus and diabetes insipidus. So what is insipidus and mellitus? Yes. In case of yes, and also yes, in case of diabetes, there is first abnormal या high blood sugar. There is abnormal sugar profile due to insulin defect. So insulin defect is the hallmark here. It is normal sugar profile, but there is what? But ADH defect. So remember, ADH defect causes diabetes insipidus, which we'll discuss in nephrology, and the glucose sugar effect is insulin. So that is why the older doctors, they found two kind of diabetes, one with abnormal sugar, one with normal sugar. They called as mellitus and insipidus. Okay, so how can you differentiate? Very simple. Check the blood sugar. Check the blood sugar. So now older time, they never had this ability. They cannot check the glucose estimation. So how older time doctors who name it the disease diabetes, how the older doctors knew about that. Okay, how older times doctors used to diagnose. They don't have sugar profile. They cannot do a Benedict test. Yes. So older time they used to taste, not test. They used to taste the urine. So like patient come, doctor sahab, I have too much urine. Nadiya bhar bhar ke balti, bucket bhar bhar urine, buckets urine, doctor sahab, bucket. You say, okay, bring me your urine sample tomorrow. So now the patient will come with the urine sample. ऐसे, doctor sahab, urine ले आया. मैंने कहा, okay, glass में डालेगा doctor, and then the doctor will take a sip like this. Oh, sweet, too much meetha, mellitus. Okay, mellitus means sweet. So mellitus means sweet. So now urine is sweet. Diabetes means urine. So sweet urine. And then in his eating, I'm not interested. मजा ही नहीं आया, बिल्कुल फीका, tasteless. So tasteless. That is insipidus. So insipidus means without any change. Okay, so that is the word. Okay, I'm not joking. I'm one of the most sincere teacher. So remember the meaning of the word insipid. Insipid meaning. See, it means without interest. See, read without taste, flavor, or color. Insipid. Now you got the idea. Are you clear? Okay, so that's why. And if you think I'm joking, okay, okay. Urine taste older time. Check. So older time. See, check. I'm not joking. Okay, I'm your most open minded doctor. See, so this is a chart they used to use. So history. So imagine with tasting the urine. Read it. Read it. I'm not joking. Tasting the urine. Okay, tasting the urine. Okay, and identified in older time that there are sugars and but middle ages they use uroscopy, practice of studying. So they used to check the color, smell, and sight. Color. Imagine being a doctor in that time. Color, smell. So they had chart. Color. Red color, hematuria. Brown, green, yellowish, jaundice. Okay, transparent. And taste also they'll write bitter or it's very sour, means acidic, or it is sweet. See, so Dr. Thomas Willis, he's wonderfully sweet. Wonder, see the word wonderfully sweet, as if honey. That's when Sanskrit madhumeh means honey like urine. So that is why what is madhumeh means? Madhu mein. Madhu means is sweet like this. Okay, madhume meaning. That means Ayurvedic doctors they never had an idea that there is a diabetes in which sugar can be normal also. So name Madhume is only for diabetes mellitus, not for diabetes. Okay. So Madhume, okay, that is sugar in urine. Okay, that is honey like urine. Meh means Madhu is honey. Meh is yes. Pishab mein shakkar. Done. So why are you people getting so disgusted? Okay, this is part and parcel of our life. We are doctors. Okay, doctors can do anything. Okay, it's a Sanskrit word madhumay. Okay, it is not just what Marathi. In fact, Marathi is a language which is belonging to this what do you say, Devanagari script languages, and it is obviously a derivative of Sanskrit only. Okay, now you're going too much deep. Okay, please not going that direction. Okay, this is too much. Okay, let's focus on the topic. Okay. Chalo, let's start. Okay, so we are studying. Okay, what is the important thing? Okay, so what happens in diabetes? So we'll discuss now diabetes mellitus, DM. First is it is a disorder. It's a disorder of blood glucose, and it is related to what? So it is of insulin. Two main types: either less insulin is DM1, and insulin fail to act is DM2. So insulin fail to act is DM2. Okay. So are you clear? So that is DM2. Okay. So DM2 is it is insulin is there can't act in DM1. Like example, first you don't have a car, or you have a car but you don't know how to drive, or the car is not working. There's a puncture. So that is the case. So this is called as two types of diabetes, DM1, DM2. Now let's discuss the pathophysio. First we'll discuss insulin. What insulin? So insulin shift potassium and glucose from blood to cells, from blood to cells. So are you clear? So it will shift it from blood to the cells. So what is the result? It causes hypokalemia and high
hypoglycemia. Hypoglycemia. Hypoglycemia is less than 70 milligram percent. Glucose less than 70. Okay. And as the cells get the glucose, they use this glucose for their metabolism. Okay. So yes, it can be used for treatment of hyperkalemia, which I discussed already, and I'll cover once again. So question is, so therefore cells get glucose for metabolism. So they are feeling satisfied. Satiety is there. Cells are happy. Yay, we are getting glucose. So they are happy. Satiety, satisfaction. Then also, yes, they are having growth and store energy. So that's why cause weight gain. So that is why it causes growth of the body. Okay. So cells get the glucose for metabolism, growth, and store energy. That's why weight gain occur. So what is the one line summary of insulin? It shifts glucose to the cell. How? Mainly via GLUT4. Okay. How? Via GLUT4. So via GLUT4, it shifts glucose to the cells. Now, what happens in diabetes? The insulin is not acting or not there to act. So glucose will not go to cell and it will accumulate where? It will accumulate in the Radon. So now what happens? Sorry. Now what happens in diabetes? What happens? The glucose won't enter cells and remain in blood. So that causes two things. If it remain in blood, that causes hyperglycemia, and if it won't enter the cell, cells will not get satisfaction. So that will cause what? Lack of energy. So that's why they will have not satisfied. So they'll be hungry, okay, and lose energy, weight loss. And because of hunger, person will eat a lot. So person eat a lot, so hungry, that cause polyphagia. Okay, hunger because glucose cause polyphagia. So there is polyphagia, there is weight loss because of lack of energy. Okay, and hyperglycemia will cause what? Now this glucose will cause multiple effects. Radham, what is the effect of hyperglycemia? So right, hyperglycemia, what will be the effect? So hyperglycemia, number one, it causes the glucose to be lost in urine. So glucose excreted in urine, okay, that is called as diabetic this glycosuria. Yeah, because cells are not able to utilize na. So glycosuria or glucoseuria, same thing. Glycose or glucoseuria is same. If someone says, sir, is it glucose? Yes, glucoseuria, glycosuria are same. Okay, and this causes increased urine output, called as osmotic diuresis. So person is making more urine, that is called as osmotic diuresis. Are you clear? So osmotic diuresis is taking place. Next question. Okay, and that causes polyuria, increase urine output, polyuria, more than 3 liters a day. So that is why the patient is having complaints of what? Complaints of loss of urine, polyuria. Okay, now polyuria will cause dehydration, so that's very severe dehydration. So this dehydration, hyperkalemia, and that causes what? Dehydration, increased plasma osmolarity because of glucose, and causes increased thirst and drinking. This causes polydipsia. So the patient develop polydipsia. Polydipsia in this case. Are you clear? So are you clear? So clear now? So that causes the, yes. And number 3, this glucose in the blood will start reacting. So glucose in the blood will start reacting with what? With, okay, clear? So blood glucose bind non-enzymatically, that's why it is slow, take months to year. Non-enzymatically, that is very slow. So bind non-enzymatically to proteins, example hemoglobin A, okay, then membranes, lipids, membranes, etc., and damage them, especially kidney, retina, okay, and this cause nephropathy, retinopathy, and actually these products are called as AG, advanced glycated end products. Okay, so what is it making? Advanced glycated end product which damage the tissue, retinopathy, neuropathy, angiopathy, etc., and they take years to decades. So that is why we need to evaluate the diabetic patient for all these conditions. Okay, clear? Also it will decrease the immunity because immune system is again affected by all these changes. So that is why poor immunity, etc. Okay, poor immunity, wound healing. So are you clear? See, when you are binding something, it affect its natural binding activity, and that cause, like example, it causes mesangial proliferation. In retina, there is what? There is damage to the capillary because the destruction of the what cells occur. There is parasite, so it causes microaneurysm. There is a hypoxia, and that hypoxia causes vascular growth factors, and this vascular growth factors will again cause proliferation, that cause the so this I'll discuss briefly later, but mainly remember it is bind and create the glycated end products which can damage the stuff. Okay, clear? They can damage them by binding. Okay, okay. Now we'll discuss next. So what are the clinical features? Okay, so there are more than thousands of clinical features, but there is a triad. Okay, so triad is there. So triad of what? Polyuria, polydipsia, and weight loss. What is not a problem? Polyphagia is non-specific. Okay, others include polyphagia. Others are polyphagia, increase infections, especially opportunistic infections. Okay, then uh, the immunity is very weak, so there is poor wound healing. Okay, decrease energy because glucose is not getting, decrease energy. All these findings are present. Just give me a second. Okay, all these findings are present.
Okay, let's start.
So decrease energy, etc. So these are the features. Okay, so now question is, someone ask, okay, what is diabetes? So diabetes is a very strange disease. It is like a person stranded in a ocean. I'll give example. So like, have you seen that movie Life of Pi? It's like a person who's stranded in an ocean. So there is water everywhere. So what is everywhere? Water is present everywhere. Okay, but still the person is not having drinking water. So this is what, the person is having water everywhere, but still he is thirsty. Why is this person thirsty despite water everywhere? Reason, he cannot drink it. So that is what diabetes is all about. The person is surrounded by glucose everywhere. There's a cell, and this is blood. What is there in blood? Glucose. But this glucose cannot enter the cell without the glut. So that's why the glucose stay outside. So that's why someone said diabetes is just like a person who's thirsty surrounded in the ocean. So it is surrounded in the ocean. So that is the concept we will see or we will have. Okay, so person stranded in a ocean. Okay, fine, person stranded in a ocean. Okay, and someone gave another example, sir, bank people. मैंने कहा बैंक people how? क्या सर बैंक that clerk, cashier, money, bank money is everywhere. There is money, but they cannot take it now. मैंने कहा very good, yes, very good. It is very good example. Then someone even gave a very dirty, disgusting example, and I don't know, people are such. He says, sir, girls hostel watchman. मैंने कहा how girls hostel watchman is a poor person. कहता no sir, girls and girls everywhere, but he cannot. मैंने कहा चुप, dirty person, always talking dirty. So that's why please don't do these things. Okay, clear? So I will not take any such disgusting thing. Okay, so don't take such an example, very bad. Okay, chalo. So you understood the concept now? Okay, chalo. So start. Now we will see the diagnosis. So diagnosis is made by which criteria? So diagnosis, we'll discuss the diagnosis. So we'll discuss everything, just need your support. Okay, so first is we'll check the sugar profile, blood sugar profile, blood sugar profile. So which profile? blood sugar profile. Okay, are you clear? Now what is the BS is blood sugar. Now first question is, what is blood sugar we take? First we take is FBS. What is FBS? Fasting blood sugar. And it is taken after 8 to 12 hours without food. So that's why the easiest way is what? We ask the patient to come in the morning without eating anything. So how to remember this? See, understand. When you people take dinner in the night, okay, 8 o'clock, 9 o'clock, and you people anytime, okay, doctors anytime, and then when you wake and sleep, sleep and wake up. So by the time you sleep, it's almost 8 to 12 hours. Remember in the night, so when you wake up, are you very hungry? So you are in a fasting state. So that is why we are in fasting. And when you eat something, it break that fasting state. That's why morning food is called as breakfast. Are you now clear? So it is called as the breakfast. Okay, it is called as the breakfast. So some people, this is the, how old were you when you knew this, that breakfast means breaking the fast? Okay, some just think, I used to kid think ki, what are you breaking something, what you break? So then I realized later, oh, fast is, yes, breakfast. Okay, so that is why, what is that, it is 8 to 14 hours breakfast. Good na, breakfast. Okay, then what is the value? So normal, see, so many people never realize the information was there in front of them all. Like the W in that movie, W in that garden, remember the W? So W, I just show you W, Dhamal film W. It's a very important thing to remember. So the W, this was the W, this W was always there in front of them. Remember the movie? So this W was always there and they were keep searching for W in the whole movie. And that is what I'm trying to say. Sometimes things, the answer is in front of you, but you're not able to see that answer because your mind is not able to connect. So that is the idea. Clear? So let's start. So normal is 100. So I'll just write the normal is 100, 100, less than 100. 100 milligram percent, 100 milligram percent, okay, 100 milligram percent. And what is diabetes mellitus is more than equal to 126 milligram percent. And with what is pre-diabetic? Pre-diabetes mellitus or impaired tolerance. So pre-diabetes mellitus or impaired tolerance will be how much? It is equal to 100 to 125 milligram percent. So that would be called as a impaired tolerance. So what is impaired tolerance? 100 to 125. So 100 to 125 is the impaired tolerance. Are you clear now? So 100 to 125 is the impaired tolerance. Okay. Now, okay, fine. Now comes the question, right? What do you mean by impaired? It is still not diabetic, but on the verge because the glucose is higher than normal. Are you clear? One more thing to remember is, right, that is something called as the conversion. Remember, 18 milligram percent is 1 millimole per liter. So sometime you will see that they are using millimoles. Okay, so millimoles are 18 milligram percent equal to. So in India, when we say 180, it's 10 millimole. In America, Americans use millimoles, and India will still use milligram percent. Okay, clear? Then there is a test called as GTT. So what is GTT? Glucose tolerance test. So GTT is glucose tolerance test. What is the funda or story about the glucose tolerance test is or would be. So first is, it is done after you suspect it. Okay. Okay. What are the funda? First we give oral glucose 75 gram, 75 gram, which glucose? Oral glucose is given. Now after you give oral glucose, what will happen? So I don't. So after you give the oral glucose, what happens? 1 second. Okay. We check blood sugar. Okay. So we check blood sugar now and after 2 hours, then and after 2 hours. Now, in a normal person, the sugar will not be very high. Why? Insulin, if it's normal, it will make the sugar very normal. So that's why it will not have very high blood sugar. Okay, very high blood sugar will not be seen. Okay. So now what are the three possibility? One is normal. So normal would be less than 140 milligram percent. Diabetes mellitus will be 200 or above. So double century. So remember, if he hit a double century, congratulations, not to him, he's diabetic, to you, the doctor, because you've got a patient. So double century. So remember, double century means diabetes. Da 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 da. Double. So double laga double. Doso. So double century means diabetes. Okay. And diabetes is obviously a very big business. Okay, you are right. So diabetes is double century. Double century. Okay. Then if you are below 200, you are impaired, pre-diabetic. Impaired tolerance is 140 to 199 milligram percent. Okay. Now sometime we don't have time for fasting or GTT, we want immediate, so we can do RBS. Okay, so RBS is not very good, but if anytime, RBS is random blood sugar, anytime. It is easy to do, so that means anytime. So right now, if I do my blood glucose, it will be like a random blood sugar in the 4 o'clock random. But if I'm fasting in the morning and you take, that will be fasting blood sugar, fasting blood sugar. And it will be values similar to what? Similar to GTT. Double century means diabetic. Double century is diabetes mellitus. So equal to or more than 200 milligram percent. Impaired means the body is not able to handle glucose properly. That means impaired. So impaired means can't handle glucose properly, indicating some diabetic like condition like pre-diabetic. Can't handle manage glucose properly, hence higher levels. Not as high as diabetes, but still. Yeah, it's not very accurate. So RBS is not a very good, hence higher glucose levels. But not diabetes, not as high as diabetic. Okay. The best investigation is not this. Best investigation is HbA1c. Okay. But the best for diagnosis is HbA1c. That is glycated hemoglobin. Now, why it is best? The reason is simple. When you check blood sugar, it tell you the sugar level that time. Like example, if you check money in my pocket, that will tell you the money I have now. Okay, but you don't know how much money is there in my bank account or my earning, so that you have to check more. So that's why the blood sugar give you that immediate or short term level of glucose, but HbA1c indicate long term glycemic control. So what it indicate? So it indicate glycemic status over past 3 months. Past 3 months. Yes. So HB is best. HB is best. Okay. So who's the best? Hemoglobin HbA, glycated hemoglobin is best over past 3 months. Okay. So that is why blood sugar indicate only short term. So that is why it indicate a long term glycemic status, and diabetics have sugar uncontrolled, and we want to know whether it is now or over past long time. So that is why it is much better. Okay. It's a but like what should you check? The marks of a student in present test or all year marks? So that's why what matter? This single test or all year? All year matter. Like you win all the match, but finally you lose. So you will become a bad team. Same way is this. We will prefer to watch your overall performance. Or Tendulkar gets out on 0. That doesn't mean he's a bad batsman. He's average. So like a average versus match score. So what is better? Average of the batsman or the score in that series or the match? Obviously, so it is the case. Okay, so it's superior to blood sugar because that's why it indicate a long term glycemic status. Okay, so it indicate glycemic status over past 3 months. Okay, past 3 months. And why past 3 months? Because it forms very slowly. Reason? It is formed by slow binding of glucose with hemoglobin. So obviously, how much time will take? Almost 3 months. So that is why it is the best. It is the best. Okay, clear? And what are the uses? So that is why uses of HbA1c. First, diagnosis. So patient with high HbA1c, we will be sure he's having the diabetes. Then number two, for treatment. Why treatment? Whether treatment is successful or not. Let's say I give a drug, blood sugar decrease now, but HbA1c remain high. So what is better? Obviously, the treatment should be on the basis of HbA1c level. So that's why treatment on the basis of HbA1c level, glycated hemoglobin levels. Number three, the prognosis, that is severity of future prognosis. So lower HbA1c, better prognosis, less side effect, less complication. And number four, severity. Okay, severity is again low HbA1c means less severe. So person with 9 HbA1c, other with 7. Who's better? Obviously 7 is much safe. That is the case. Okay. Severity is given. So HbA1c give the severity also. Okay. Severity. Okay. And also since it indicate long-term level, it is always best to look at the HbA1c for getting an idea about the previous status. So that's why all are the findings. So treatment on the basis of what? HbA1c level, prognosis is low HbA1c, and also low level of this. Okay, so less severity. So are you clear? So therefore, sometimes you need something for shorter. So remember, blood sugar indicate that few hours, okay, or few days. Okay, so remember, so for short term glycemic status, okay, of 2 weeks, we use serum fructosamine level. Serum fructosamine. Okay. So sometimes we want to check whether treatment is working, so you can check the fructosamine level. But for long term, control, that is 3 weeks, 3 months, sorry, by HbA1c. HbA1c. So are you clear? So that is the whole story. So that is the whole story. Are you clear? So whole story is clear. Okay. Now what are the level of HbA1c? So write the level of HbA1c and we will discuss it properly and we will see. Okay. So write the level. So write. Okay. So start. So first is we'll start with the value. So normal HbA1c should be less than equal to 5.6%. So remember like this, it is 5.6. Diabetes mellitus is equal or more than 6.5. So you can remember it like this, 5 and 6 is a normal counting. Like if you are playing Ludo, you want 5 or a 6, yes or no? So 5, 6 is normal, 5 and 6 is normal. पंजा छक्का normal. पर पहले ही छक्का आ गया, छक्का मीठा है मीठा. So chakka is sweet when you get 6 in a ludo. Yes, it's very sweet sensation. Na? 6. So chakka panja, diabetes. Chakka panja. So remember, 5 6 is normal. 6 5. Chakka lag gaya to? Yes, chakka panja. So 5 6 6 5. 5 6 6 5. Are you clear? So 5 6 6 5. 5 6 6 5. Are you clear? So remember 6 and 5 is normal. 6 and 5, sorry, diabetes, and 5 6 is normal. Okay. So पंजा छक्का normal, छक्का पंजा मतलब मीठा है, sweet है, chocolate खानी है, celebration करनी है. So 6 is मीठा, मीठा means diabetes, sweet. So what do you feel when you hit a 6? Very sweet. So sweet is diabetes. So remember 6 and 5 is diabetes. 6 and 5 is diabetes. Okay. So are you clear here? And what is impaired tolerance? Impaired tolerance or pre-diabetic is 5.7 to 6.4%. So 5 points. So please remember these values. They are very, very important, clear, and you will be seeing. Okay, clear. So in Hindi, saying someone sweet is not a good thing. Don't call anyone sweet in Hindi. They might beat you very badly. Okay, because in Hindi that means something else. People create. Okay. Now I'll make a summary table. Please look at this summary. It is the most important topic. So what we're discussing, summary. Okay, summary. Okay. So I can't explain in Hindi. Please, anyone can explain. They can explain. So summary. So right here, the values I'll write here. Normally, better I'll start with diabetes. DM, normal, impaired. Right here, HbA1c, then so HbA1c, okay, so HbA1c, right, then FBS and GTT, and I want right answer for all. Not a single mistake is acceptable. This table is 100% exam question. 100% exam question. Okay. So first, what are the value for diabetes? More than 6.5%. Then FBS more than 126 milligram percent. And GDT more than equal to 200 milligram percent. Same as RBS, random. So 65, 126. Please remember this table. 100% exam questions. Okay. Then normal. What is normal? So normal is basically in this case less than 5.6% or equal. This is less than 100 milligram percent, and this is 100 to 125 milligram percent. Are you clear? Clear? And impaired is between the two, 5.7 to 6.4. This is 100 to 125. So 100 to 125. So 100 to 125. Okay. And then in GTT, what is the concept we will see in the GTT? It is how much? Oh, I just made a mistake here. Okay, clear? So it's not 125. Okay, yeah, it's right. And this will be how much? This will be how much? I just wrote mistake here. I will discuss. It is impaired is less than 140. Yeah, this was the mistake. Okay, 140, and this is 140 to 199. Okay, so that's what I'm telling you. Please try to remember them perfectly. Otherwise, you'll always have problem. The way to remember is repeat multiple number of times. But I know I have made you remember this very well. Chakka panja 656565 is HbA1c, 126 is fasting, and GTT is double century. GTT is Game of Thrones double century, double season. Na? Now the second season House of Dragon has started. So GTT, Game of Thrones, is double century. Game of Thrones is double century, or you can remember double century. Okay. Fasting is 126. Fasting is 126. Okay. Okay, 126. And HbA1c meetha is 6.5. Okay, sweet. Done. Chalo. Let's start now. Now we see the types of diabetes. So there are two main types. I don't watch any of this web series, etc. I don't have time. Clear? My most of the time is spent preparing the concepts and notes. So two main types, DM1 and DM2. So first we'll discuss DM1. So in DM1, basically what happens, there is less insulin production. Okay. Due to destruction of beta cells. So destruction of beta cells is there. Okay, clear? So that is why what happens. Okay, mostly it is autoimmune. So mostly it is autoimmune. So it is autoimmune. Type 2 hypersensitivity. Type 2 hypersensitivity. So HLA are involved. Remember, for diabetes, HLA, which one? AQ1. So HLA AQ1. Then how many doctors are needed to treat diabetes? Tell me. How many doctors we need to treat the diabetes? Tell me. So HLA DQA1. Sorry, DQA1. How many doctors are needed to treat the diabetes? Either 3 or 4 doctors. 3 doctors or 4. So DR3 and DR4. 3 doctors are what? We need a medicine endocrinologist, 1 retina ophthalmologist for eye and kidney nephrologist. Sometimes we need neurologist also. So 3 to 4 doctors are needed for diabetes. So 3 to 4. 3 to 4. Okay. Clear? 3, 4. Okay. So DQA1, 3, 4. DQA1, 3, 4. DQ, 3, 1. Okay. मेन इज 3 and 4. रिमेंबर 3 डॉक्टर्स. सो ऐसे याद कर लो 3 और 4 डॉक्टर्स needed to treat diabetes. So how many doctors? 3. Okay, clear? Now comes the question, what are the autoantibodies? So the autoantibodies are against they are islet cell antibodies, ICA, or they could be insulin, IAA, insulin autoantibodies, IAA, IAA. Okay, yes, fine. And also GAD antibody. What is GAD? Glutamic acid decarboxylase. Glutamic acid decarboxylase. So glutamic acid decarboxylase is the case. So there is a glutamic acid decarboxylase. Okay. Now question is, if they type ask you, so DM1 has 2 types. DMA is autoimmune, and DMAB is idiopathic. We don't know the exact reason. Idiopathic. It is idio. Okay. Now, since it patient is having less insulin, we will treat with insulin. So that's why also called as insulin dependent diabetes mellitus. Are you clear? So low insulin. Okay. Now we'll discuss DM2. DM2 is basically what happens. Insulin fail to act. So there's a normal or rather high insulin because pancreas is not having problem, but fail to act at tissue called as insulin resistance. So there is a insulin resistance. Okay. Example, obesity, or by resistin hormone, or inflammation, TNF alpha, leptin defect. All these causes insulin to fail to act. So insulin fail to act because of all these factors. So that is why now the person is having high level of insulin, but it failed to act. So that is why it is insulin. There is no antibodies, or antibodies are not formed, but rather there is a genetic or family history. Okay. So most patients have genetic basis. So family history is positive. Family history is present. So if I were to give a summary, what is DM1? It's mostly autoimmune. DM2 is mostly and have a low insulin. DM2 is basically insulin is present, but it cannot fail to act at tissue or on tissue. Okay, so either receptors are less something. So what can be the reason? Reason maybe less receptors. Okay, most likely mechanism. Leptin is a hormone which prevent obesity. So leptin prevent obesity. So defect in leptin can cause obesity. Okay, so it prevent the obesity. So most likely mechanism of insulin resistance is down regulation of insulin receptors. So that is the most likely mechanism, and that's why there is a high insulin needed. So that's why insulin sensitive is not there, but rather resistance. Okay, And what is the level? So that's why it is defined as high insulin levels more than 100 units a day. So to overcome the resistance, what is the insulin level? They are must be maintained or given 100 units a day. So that's why in type 2 diabetes we will avoid to give insulin. Why? Because there is a resistance. So that's why we will need to give high insulin. So what is the level? More than 100 units per day. So let's say a person is having 60, we need to add 40 more. So that's why more than 100 is insulin resistance. So remember, what is insulin resistance defined as? It is not able to act, so that is why more insulin needed. So higher insulin level needed needed. So how much needed? More than 100 units per day. More than 100 is this. Okay, so I'll make a table giving the differences and we need to be perfect in them. So please remember them, please understand them. It is very important. So let's start now. Clear? Chalo, let's start. So I'll make a table and write DM1, DM2 table and changes. So first, insulin level. So insulin and C peptide. C peptide is formed along with insulin from beta cell. So it is low. It can be normal or high. So C peptide and insulin come from beta cell. So they are normal. Okay. So that's why the person is having. So insulin can act so sensitive, means insulin act properly. There is resistance, need more insulin. So there's resistance. So who's sensitive? DM1. So that is why other name, okay, other name IDDM, that is insulin dependent diabetes mellitus. So IDDM is insulin. It is since insulin is not acting very well, so it is non-insulin dependent mellitus. So NDDM. And nowadays, no one uses these terms. NIDDM. NIDDM. Pathophysio, autoimmune antibodies are there. Autoimmune antibodies present. Mostly. Here it is genetic or family history. Family history, okay. You know, autoimmune occur mostly in younger people. So that's why this occur mostly in the younger people, okay. So it is, okay. So thank you for coffee, okay. So younger people, okay. So what is the concept of younger people? So autoimmune are very common in younger people because they manifest much early. So age, it is mainly juvenile, so also called juvenile, okay. So children or adolescents. Age group is very less, it is 10 to 15 years. So that's what's occurring in young adolescents. It is middle age, 40 to 50 years. So that's why it is occurring in older age group, okay. So what diabetes occur mainly in older people? It is DM2, okay. DM2, okay. Don't look at the glass and think this glass looks something else, okay. I drink tea coffee in this glass because it make me feel very motivated, okay. So this is a motivational glass because they resemble like, you know, proper, you know, you understand now, okay. So proper glasses. Okay, so that is there. Okay. Okay. Then next question, the weight. Since the child developed diabetes, it will cause loss of weight. So weight loss is there. So thin can be stunted or wasted. So remember, if not treated, this child will not be able to grow because you need insulin for the growth. Okay. Yes. Okay. And here he is obese. Now remember, he was obese and then he become resistant. Don't get confused. Sir, weight loss occur. He is having resistance that caused the diabetes. So that's why obesity occurred first. So obese, then become obesity, then resistance and diabetes. So don't get confused. Ki, sir, you said weight loss. He is already obese. Then he become diabetic, okay? And weight loss occurs. So now you say, suddenly I'm losing weight. So that is the case. Don't get confused, okay? Then what will be the prevalence? What will be more common? So obviously prevalence. Who will be more prevalent? Obviously it is 5% less common, 95%. So most of the diabetes are type 2, okay? Type 2, okay? See, obesity is not a part of triad. Obesity can be said to be one of the risk factors for DM2, okay? So it is present. So it is not the case all obese are diabetic or vice versa, all diabetics are obese is not the case. Then high risk of diabetic ketoacidosis, DKA, that is diabetic ketoacidosis. It is more here. It is here but less. So less common. So more common, it is most common in DM1. Most common. And finally, treatment. Obviously here one and only give insulin. Here insulin only when there's a resistance. Okay. Otherwise oral so insulin if drug resistant. Insulin if drug resistance, else drug of choice is metformin. Drug of choice is metformin. Okay. So drug of choice is our metformin in this patient. Are you clear? This table, one question will come for sure. So one line summary. If there is genetic basis autoimmune, what are the diabetes? Genetic autoimmune. So it is our which one? It is our diabetes. Okay. Type 1. And if it is not having antibodies but rather genetic, it is DM2. Okay. Older person, DM2. Obese, DM2. Okay. Resistance, DM2. All. Now other types of diabetes. Now come very famous LADA. LADA. LADA is latent or late onset, latent autoimmune diabetes of adult. So simply it is DM1 in elderly. So it is nothing but DM1. There is less insulin. Antibodies are found. Okay. Clear? Remember, resistance means you need more insulin. It doesn't mean insulin is not able to act. It means we need more insulin. Clear? So that's why we can either give drugs or decrease the resistance, or we have to give extra amount of insulin. Okay. So LADA. So LADA is latent autoimmune diabetes of adult. DM1 is in elderly. Okay. So that is why there is autoimmune. Antibodies are found. So there is GAD antibodies are present. And what is GAD? Glutamic acid D. So remember LADA mein GADA. LADA mein GADA. LADA GADA. You'll never ever find it. In fact, LADA is a Gadi car in Russia. LADA GADA. GADA. And if you add LADA GADA. And remember Dadaji. It occurs in Dadaji. Dadaji means elder person. Like in our country, Dada means grandfather or Dada. सही है? So Dada ki LADA. Okay, and don't put N, it become Danda, or above can become something else. Okay, सो लाडा में गाड़ा, लाडा गाड़ा, लाडा गाड़ा, ओके। एंड दादाजी को होती है एल्डरली, दादा मीन्स ब्रदर ऑल्सो एल्डर, दादा मीन्स एल्डर, सो लाडा गाड़ा दादाजी, लाडा गाड़ा दादाजी, ओके। एंड एल जी, L and G. Remember? So don't add N between the gada, it'll become something else. Okay. Clear? Chalo. So will you remember it now? Lada, gada. And features are similar. There would be less insulin, sensitive, and treatment is insulin. Okay. So I think you will never forget. So I hope this medicine is becoming easier for you. You're no longer terrified of this subject because you have done, okay, you have done it properly, okay, because at the end it is vast. Even this is not sufficient to solve all the question, but you are now at least able to solve 70-80% question, plus you can even make a good guess. Without knowledge, zero guess. Now you know something, lada gada, if they mention some new kind of feature, you will able to solve that. There'll be what feature similar, so sensitive, low insulin level, everything is similar, okay. So let's move. Lada, Gada, then Chidiya. Remember Chidiya? What is Chidiya? Birds cause. Which pneumonia birds cause? Which pneumonia birds cause? Tell me. Birds, birds. Birds cause which pneumonia? Yes, city causes. Chlamydia, city causes. Drug of choice? Throw a stone at this shitty chidiya. Yes, see, that's how you people remember is the most important thing. Otherwise, everything is there. We have to remember. Aji throw. See, and legi, cruise ship, AC, maje legi. What is the infection cause in air conditioner, shift, shaft, cruise, hotel, convention, conference? What is the infection? Legionella. You will not forget all life. Legionella is now your favorite drug. Very good. Disease and drug of choice. Again, throw this influencer or person in the ocean. That is Ajithro again. Ajithro. Very good. Okay. That is what I like about you. That you people are meme lovers. If you are taught in meme language, you remember better. Non-meme, you forget. Now come मित्रो मोदी. So मोदी जी आ गए हमारे. मोदी जी is maturity, onset diabetes mellitus of young. Okay, Modi ji is back. Modi ji, Modi, and Modi ji is, remember, age, young person. So age less than 25 years. So it is occurring in young people less than 25 years. So it's a DM2. That is, there is no autoimmune, no antibodies, not autoimmune, but genetic disorder. Rather, there's a genetic disease. It is autosomal dominant, AD. And we all know Modi ji is dominant person. Modi ji is not going to bow down in front of anyone. He's a dominant. Remember, Modi ji is dominant. Modi ji is dominant. Okay. Second, 6 type. Okay. So there's a family history. And you know, in family history, since dominant, it is both parents and children affected. So family history positive. Parents and kid both have the disease. Then it has 6 subtypes. 6 subtypes. Most common is 3, type 3. So remember, Modi ji is having 3 names, na? Narendra Das, Damodar Das, Modi. So he's having 3 names. So Modi ji type 3 is most. And remember, type 3. And his friend Donald Trump has Do. Donald. Okay. So remember, Modi ji is 3, Donald Trump is 2, Biden is also 2, but he is 3. So Modi ji is 3, 3. Modi ji 3 है, ठीक है? Modi ji 3. Okay. And his friend has 2. Donald Trump is 2. Number 2. Okay. Do means 2. Then there is a defect in HNF alpha gene defect. Okay. So what is HNF? It is first human is hepatocyte nuclear factor alpha. What does it do? It help in what thing? So it is hepatocyte nuclear factor. Done. So what is the funda about the hepatocyte nuclear factor? It help in regulation of insulin. That is why what happens is, unlike actual DM2, there is again less insulin, no obesity because young person, no obesity, insulin sensitive. So that's why treatment will be what? Treatment will be what? Yes, again treatment is insulin. So technically it is a DM2 in a DM, it's actually DM1 and 2 both. So it is your Modi, okay? Modi, okay? So Modi is maturity. So let me give a summary so you remember it very well. Summary is except DM2, all have low insulin and insulin sensitive. Insulin sensitive. Okay. And treatment is also insulin. And they are DM1, Modi, Lada. So these are our types of diabetes. Okay. So DM1, Modi and Lada. DM1, Modi and Lada. Clear? So DM1, Modi and Lada. Now I'm giving a summary. Remember this summary, it's a very important topic. Don't ever forget, it is very, very important. Right here, age, young, old, autoimmune, that is antibodies, genetics or family history. No antibodies. Clear? So that is autoimmune diseases. Autoimmune. So let's start now. चलो नेक्स्ट स्टार्ट. Okay. Young person with autoimmune. What do you think? Young person with autoimmune. What is your diagnosis? Tell me the answer. Young person. Young person. Anyone? Young person. DM1. Very good. I'll use different color to write. I'm very proud of you. DM1. So young person with autoimmune, less insulin, all are less except that. Okay, that is having resistance. Okay, so it is DM1. Very good. Old person with antibodies. Old person antibody. Old. This table. Old person. Here. Old दादाजी 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 दादा 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 मोदी दादा लाडा लाडा में दादा दादा में गाड़ा गाड़ा. Okay. Okay, clear? Very good. Okay. Okay. Now, genetic history in a younger guy. Young guy less than 25 years and is having a genetic history. No antibody. Younger guy. Younger guy. Modi ji. Modi ji. Modi ji. Very good. And this one. Last one. And this is the only one with insulin resistance. All are sensitive. Okay, all are sensitive. Okay, so the only one with sensitive resistance is to rest all. So I hope this table is easy for all of you. I hope this table is easy for all of you. Yes or no? So Modi, Lada, all. So what is the summary, guys? So is this summary going to solve one question for you? Are you confident? Because we are working hard to get the concept clear. Otherwise, this information everywhere. There are books and books of information. You can keep reading them. But the problem is what? It is not the information. It is there. You open internet, you just type what? Modi, Lada, just right? Modi, Lada, you will have multiple information. See, Modi, antibody, GAD. See, GAD is there. So information तो ऐसा आएगी कि मतलब you will have, see, Modi 1 2 3 4 HNF 3 is most common. See, this I've discussed na, like autoimmune diabetes, LADA is autoimmune, antibodies form, and there are GAD antibody. So you will see Modi finding. Okay, but main thing is, are we able to solve the question or not? So that is what the main idea is. And are you able to get this concept clear? Yes. Okay, otherwise there are so much things. See, damage, relative, type 1, LADA, stay this table. It looks so confusing. Okay, this look so, but I made it easy. C peptide is nothing but what I've discussed. Damage of pancreas, all relative resistance. Have I discussed that already? Yes. So that is the idea we are having. Are you clear? So now is it clear? Da sir kanyeshno me otvetem sir sichas. Gide. Okay. Chalo. So yes, if you are missing this thing, it will create problem. It will create problem. Okay. Clear? Now we come to the treatment part and the complications of diabetes. So start with the treatment. Treatment. So remember, insulin is drug of choice. Okay. Insulin is drug of choice for, keep writing, drug of choice for DM1, Modi, LADA, then DK, Also resistant DM2, resistant DM2, resistant DM2, also also for hyperkalemia, hyperkalemia. We use insulin for treatment, hyperkalemia. Also, it is for diabetes in pregnancy, gestational diabetes, or diabetes in pregnant female. Why it is preferred? Why is it preferred? The answer is it is preferred because of which way? Reason is it cannot cross the blood-brain barrier. Reason, insulin won't harm the baby, won't cross placental barrier. So that is why it is the preferred agent. So what is the preferred agent? Insulin is the preferred agent for diabetes mellitus in pregnancy or gestational diabetes. Are you clear? Now question is, so that is the question and how is the treatment? So remember the advice for the DM1, MODI, etc. So DM1, I'm discussing treatment plan. So DM1 asks the patient to first, he should have dietary control, which I'll discuss very soon. So avoid hyperglycemic foods, okay, high glycemic index, dietary control. Number 2, regular exercise. Regular exercise, okay. Then avoid stress because stress can cause hyperglycemia. This kid should avoid stress, and we will give insulin, okay, and we will, the drug of choice is insulin here. Now 2-3 question, how to take insulin, how much to take, what is the case? So remember it is given as per the sugar level and the deficiency. It might be 5 unit, 10 unit, 20, so we have to give the insulin. Now the best mode to give insulin, so I don't, best method for insulin delivery is insulin pump nowadays. And the preferred site, at what site? At abdomen or thigh. So what it does is, this pump is a smart device. It is smart device. It sends the glucose level and release insulin. So it is smart device, sends glucose and release insulin as per the requirement. So sends the glucose and release insulin. So it will sense our, yes, what level insulin is released. Let me give an example of pump. So nowadays the best is pocket device, pump, whatever. So I'll show you insulin pump. So we'll discuss insulin pump. Can you see the pump? Okay, please don't go in something else. Ki sir, it looks fake or something. It looks something else. So why girl? I don't know. Okay, could be a guy. And how you know it's a girl? Again, you all know why it's a girl. So this is the pump infusion set which releases, this is 5.1 is millimole. They're using millimole value. You can convert it to milligram percent. I'll tell you how. Multiply by 18. So it is the monitor which sends the glucose. It informs the device and release the infusion. It has small needles which inject insulin into this. So mainly dermis. So it's given in the dermis. So it is given intradermal injection. It will give, this sends the glucose. 5.1 means how much? 5.1 18, around 90 milligram percent. So 5 millimole means 90 milligram percent. So it is normal. No need to give insulin. Are you clear? So this is the case. Okay, only problem, it is sometimes difficult to take care of. Okay, price, okay, let me see the price. It is not cheap, it is, price is more. Good quality can be lakhs. Okay, so I just show the price. So price bare basic is 5.5 lakhs. Can you see lakhs? 5.5. 1 to 4 is the normal range. I told you 1 to 4. So obviously it's not cheap device, but it is better. Okay. What are the cheaper options? Cheaper are intradermal injection. So we can use, so cheaper option. So we can give, yes, regular insulin given by intradermal injection. Very painful. Very painful. So it's very painful, not advocated at all. So it's very, very painful concept. So intradermal is a, yes, very painful procedure. Intradermal. Okay, intradermal. Okay. And second, it is very short half-life. So T half is very short, 2 to 5 minutes. So that is why it is having this problem that it doesn't act, but it is preferred in condition like diabetic ketoacidosis. Okay, so very painful. So that is why we have a longer acting insulin. So longer acting insulin. So longer acting insulin are which ones? So longer acting insulin are basically which one? They are our which ones? Yes, they are our glargine. Glargine name itself give large acting insulin. Glargine, okay, glargine or D-gludec. D-gludec. Name itself say decrease in the glucose. They glucose decrease. They glucose decrease. Yeah, D-gludec. Glargine is around 24 to 28 hours T half. This is around 40 to 48 hours. So what is the longest acting? D-gludec is longest acting. So which one is longest acting? D-gludec is the longest acting one. So D-gludec is the longest acting. What about the ultra short actings? Ultra short acting are aspart, or lispro insulin. So aspart or lispro are ultra short. They act for few seconds only. They are called as ultra short acting. So is the summary clear? So DM2 is a separate category, separate management. Okay. So I'll just write DM2 management. So DM2, okay, is basically first we use the drugs and the lifestyle. Okay, so DM2 management, it will be lifestyle modification. So remember, become Modi ji's bhakt. Modi ji bano. Lifestyle modification. That is physical activity, less stress, sleep on time, eat on time, avoid alcohol, smoking, wife. You understood now? Okay. So lifestyle modification. Okay. So Modi ji, be Modi ji. Yeah, glucasin can also be used. Okay. So lifestyle. Okay. Then weight loss is the most effective method here. Weight loss. Okay. Weight loss. Okay. And can do bariatric surgery if not bariatric surgery. Bariatric surgery. Okay. I was just giving example of Modi ji's life. I was not saying don't do anything like that. I was just giving the example. Okay. Just giving the example. Okay. Then number 3, avoid sedentary lifestyle. Sitting whole day is not a good. So don't sit whole day. You remain standing. खड़े रहो, जटे रहो, लगे रहो. Okay, sedentary. So sitting is a very bad thing. Keep moving. In fact, someone said Diabetes 2 is actually a lack of physical activity, deficiency of physical activity. Then physical activity. And humans are a very odd group of people. Why they are a very odd group? They go in a car to a fancy gym and they do bicycling there. They are going in a car and they are going to bicycle there. Does it make sense? Why don't you walk on foot or take the bicycle to the gym and don't enter and come back on the bicycle itself? So I don't know what is the case. Okay. Plus, someone said that people who ride bicycles, they are very bad for economy. Bicycle drivers are worst people for any country. Reason number one, they don't buy car, so no job to the people who are working in automobile sector, dealership. Then they don't pay road tax, so no income to the government. They don't buy petrol, so all these Arab countries, even Russia, they don't get money of the petrol from them. They are harming their economies. How will these Arab sheikhs buy gold-plated Mercedes or Lamborghinis? You are harming them. You bicycle riders, shame on you. You are harming them. Huh? Plus, they also don't get sick. If they don't get sick, they will not be going to doctors. So even doctors are not getting. So will not get diabetes patient, CAD patient. How will you put the stent? How will a cardiologist earn the money? These bicycle riders are the worst people. Clear? And they don't have any repair, etc. So they are very worst people. So they're very fit, healthy, and people who are walking, people who walk, they're even worse than bicycle riders. They don't even buy the bicycle. They don't even buy the bicycle. Okay, chalo. Chalo. Okay, so physical activity. Okay, physical activity, increase physical activity. Number 5 is BP control. Number 6, correct lipid profile. So we must do lipid profile. Why? Because it is deranged in diabetic patients. Okay, so always they have dyslipidemia in most of the people. Okay, so what is the dyslipidemia? So correct. So first is how, first question, most diabetes is a metabolic disorder. No? Most diabetes mellitus 2, they are having what? They are having dyslipidemia. Dyslipidemia. What is dyslipidemia? Dyslipidemia is basically what all changes. First, there is decrease HDL, increase LDL, VLDL, increase serum cholesterol, and triglycerides. All are increased. All are increased. All are increased. Now, what is the funda about the HDL? What is the funda? HDL is called as a high density lipoprotein, is a good cholesterol. So HDL is good cholesterol. Why it is good cholesterol? I'll tell you. It take the cholesterol from liver, from the diet it goes to liver to the tissue. It take cholesterol. Why? It take cholesterol from tissue. One example of tissue and will make the clear: vessels, arteries to liver. So technically it is causing atherosclerosis or preventing atherosclerosis. So it prevent atherosclerosis. So it atherosclerosis. So that is why it's a good. So what are the drug we can use for dyslipidemia? So the drug of choice for dyslipidemia is statins. Actually, they are very risky drugs. Okay, statins inhibit HMG CoA reductase, HMG CoA reductase, and by decreasing the activity of HMG CoA, it causes decreased cholesterol synthesis. decrease the cholesterol synthesis. So they will decrease our cholesterol synthesis. So that will cause a decrease in our cholesterol synthesis. Are you clear? Then what number we are going? 6, 7. Okay. 7. Stop smoking and alcohol. Number 8. Number 8 is dietary control. So first, what is dietary control? Decrease salt intake. Then low glycemic index food. And what is the low glycemic? I'll just give a hint. Remember, they are raw and non-sweet foods. So anything which tastes like papaya. Raw papaya has low glycemic index, but a ripe papaya, any fruit which is ripe, is high. Then if it is tasting sweet, like example, corn. Sweet corn is having. So what happens when you cook a food or we ripe a food, the carbohydrates, they become simpler sugars and now their index will increase. Index is okay, clear? So statins affect the membrane, the tissue, because cholesterol is very important for the tissue growth, membrane, etc. That's why they have lots of side effects and they are not preferred to all the patient. But if there is serious hyper, this cholesterolemia, then we need to give statins. Okay, clear? So low glycemic index is mainly raw, non-sweet. Example, salads. Example is salads or what? Gram, oats, etc. Okay, so wheat and rice have higher glycemic index. So let's show you a photo, and that is the summary we have. So I'll show the photo. Glycemic index. This is a chart for glycemic index. You can keep it with you. It will help you and remember if you want to remember. खुल जा सिमसिम, खुल जा सिमसिम. कोई नहीं, I'll make it here. This was asked recently in the exam. So the hint I can give you is, see, understand. Corn has high glycemic index. Sugars, they all are sweets. Sweet is always high. Apple, fruit, soya bean, cashew, they are non-sweet. So non-sweet have low. Sugar is obviously high. Fruits. So that is a one-line hint. Yeah, sprout, salad, they will have low. Let me see some other chart. You want to check this chart or okay, let's check this chart. Yeah. This was asked in the recent exam last year, June. So have a look. See, rice bran, that is the chilka, outer covering, low. Spaghetti low. Corn sweet is 54. 54. Okay, it is 54. High. It is high. It is high. Potatoes very high. Okay, potato very high. Okay, and papaya is given, not given, but papaya is also 50, 55. And vegetables are always low. Vegetables are good. They all are low. Vegetables, salads. Okay, proteins are also not that much. Okay, dairy is also good, but if ice cream is very high. So are you clear? Honey is a complex starch. Okay, so that's why it doesn't have that high. Okay, are you clear now? And lastly, we should advise patient to take small frequent meals. Small frequent meals rather than big bulky meals. Advises small frequent meals. Okay, so which foods? Yeah, sweet and cooked foods are high. Okay, So small frequent meals. Small frequent meal is the hint. We can give a chart, and that's the case. Okay, so grape are having, see, they are small in size, so must be that is the reason they are. See, they are not less. 46 is not low. Anything in 40, 50 is higher value. Okay, see, medium, high, 70 plus. So grapes are also not low. They are medium. Okay, fine. Grapes are medium. Okay, done. So sweeter the food, more the high index, more the index. Okay, chalo. So we will take a break, then we'll discuss the complications and the main drugs used in diabetes treatment. Okay, honey is high, I'm not saying honey is low, but honey is not that harmful. Let me check honey glycemic index. Check honey glycemic index. It is 19. See, so honey is 19. So it's not bad, but some value can change. See, honey values are different. Some are low, some are high. So honey is low or high. Some honey have low, some have high. So that's why honey can be both low and high. Can you see that? So that is the case. Are you clear now? So glycemic index of honey is 50s. Okay. Chalo. So let's discuss. See, it will take time. Okay, diabetes will take time. It will take at least half an hour. So again, it will be postponed. I don't want to break in the middle. So we'll do it after that. Okay. Otherwise, it will cause a break, like complications. So I just want to take one session of diabetes and its complications. Okay. Fine. Diabetes, Harish, will take at least 1 hour because there are complications. Ketoacidosis, hypoglycemic coma, then there is what nephropathy, etc. So it will take at least 40-45 minutes. Okay, clear? Clear? So that's why I'm taking a break. So I will complete. Okay. See, I told you, diabetes 2 patients are obese. Obese patient develop resistance. So they become diabetic. Then they start losing weight when the diabetes start. Are you clear? Diabetes 1 are already normal kids and they lose weight because of diabetes. Are you clear? Fine. So break will take for 3:30. So eat something properly. We'll start 3:30 sharp. The next break will take around 5:20. Finish everything. Then one more break at around 5:30 or something. Clear? So we have to cover thyroid and the adrenal gland, pituitary also. We'll cover them. Don't worry. Okay. Chalo. So take care. Bye bye. We'll finish the session.